Hi everyone, welcome to Rao Hospital's pregnancy web series. I'm Dr. Damodar Rao, Associate Director of Rao Hospital. I'm an OBGYN with a special interest in laparoscopy and infertility. Today we'll be starting our pregnancy web series, which we'll be having every Saturday at 4 p.m. through our Facebook page live. So if you have any queries, always you can log on at 4 p.m. every Saturday, and we're going to be here. We're going to be having a series on starting from preconception to pregnancy, delivery, and thereafter. So today we're going to be talking about preconception and how to go about it. It's a very important phase in a couple's life, the preconception period. This is very important because if you go for this particular counseling, you'll be able to reduce your time to pregnancy and see that your pregnancy, goes on safe, and you have a little one with a nice little healthy baby in your hand. So today we have Dr. Suganya with us, who is one of our lead consultants, OBGYN, with a keen interest in fertility and obstetrics. On to you, Dr. Suganya.
Thank you, sir. Good morning, everyone. This is Dr. Suganya, and I'm a consultant in infertility and obstetrics and gynecology at Rao Hospital. So today I'll be talking to you about periconceptional counseling. So first, you might ask, what is periconceptional counseling? So if you're a couple who are planning to get pregnant, you ask yourself this question: are you planning to become pregnant in the next 1 year? So the answer to that is yes. Then this is for you. So any couple who's planning to become pregnant will benefit from this. So it doesn't have to be a newly married couple. It can also be a couple who has had recurrent abortions or someone who has given birth to a child as well. Because this creates a window of opportunity for us to look at the risk factors that you may have and probably modify them and correct them so that you achieve a very healthy pregnancy. So if ever you've been having unprotected sexual intercourse for a year, or if you're over 36 years and you've been having unprotected sexual intercourse for 6 months, we'd probably be doing a little more of tests to see as to why you didn't conceive. So this is just a screening process where the goal is to screen you and get you prepared for a healthy pregnancy. So now, before going into the topic proper, I would like to explain how a normal ovulation and pregnancy takes place in a lady who has regular menstrual cycles. So this is this is the uterus. This is the tube. There are 2 tubes on either sides that connects to the uterus, and you have ovaries. These 2 are the ovaries. So this is your vagina. Normally what happens is on day 2 or day 3 of every cycle, a follicle gets selected, a few also. They grow over the cycle. If in a person who has 28 days a cycle, roughly mid-cycle, it can be a few days, front and back. But then the egg grows to a certain extent where it's ready for a rupture. It has, the follicle has the egg inside. So once the follicle ruptures, the egg travels into your fallopian tube. So when you have contact at that time, the sperms ascend up and it will reach where your egg is. Fertilization takes place and it eventually falls into the uterine cavity. This is the inner layer of the uterus. It gets implanted and that's how the embryo grows. This is a normal conception. So for anyone to become pregnant, you should have good amount of or a good quality of eggs, good quality of sperm, and also the uterine tract. All these have to be in a good condition before you're planning pregnancy. So this is the fertile window. So there's a chance that you can become pregnant around the 14th day if you have a 28-day cycle, 28-day menstrual cycle. So there is something called as an ovulatory cycle where your periods might be irregular and ovulation may not happen every month. So in those patients, what we tell is, please do not look at your apps or you will not be able to figure out when the fertile window is. So it's always advisable to have a regular sexual intercourse at least every 2 to 3 days so that there is an opportunity for the egg and the sperm to meet. Certain factors to be considered before you're planning pregnancy. I'll talk about each factor in detail. First is the age. So the ideal age, what is the best age to become pregnant, is probably between 20 to 30 years. But again, this is not a very strict cutoff. Why 20 to 30 years? Because there can be a lot of complications in patients who are conceiving before 20 years and at a much later age. So when a lady conceives before 20 years, it's a teenage pregnancy. So there is a chance that she can end up, she might herself have a lot of nutritional deficiencies. So before correcting them, if she attempts pregnancy, there's a chance that she may develop a baby who is less in weight, can have even preterm labors. And also even post-delivery, the amount of postpartum depression can be more because she might not be ready for the baby yet. And in couples who are in the lady who is over 36 years, there are other associated complications like probably high BP and high sugars, or other gynecological conditions like fibroid uterus, endometriosis, all that. And now coming to weight. So we always advise couples to fit into their BMI and correct BMI before attempting pregnancy. So BMI is body mass index, and 20 to 25 is normal. So roughly you can calculate, you can even calculate your ideal weight by subtracting 100 from your height in centimeters. For example, if your height is 170 centimeters, you subtract 100 from it. So roughly 70 kg is what you should be weighing. It will fall into your normal BMI range. So people who are underweight again can have small babies with which may not grow adequately. And also people who are overweight will have much more complications. Like the baby can be quite big. So as a result of which normal delivery might not be possible. They might have a smaller pelvis in comparison. Also pregnancy complications plus post-pregnancy complications might be more, like deep vein thrombosis, all that. So next is whether you and your partner are related to each other. So there are a lot of marriages happening within relatives. So we always advise such couple to have a genetic counseling, or even people who have had history of recurrent abortions to have a genetic counseling before proceeding with pregnancies. Next is your family history. Family history can be very important because in a couple, a mother whose parents are diabetics may have a stronger tendency to have diabetes during her pregnancy. So certain detailed tests need to be done to see if she also falls into the high risk category, and then management has to be done accordingly. At the same time, even high hypertension and so many other things can be can prove to be a high risk factor if the parents or siblings have it. Now coming to your previous pregnancy records, it is very important that you take your previous, if ever you're planning your second or your third subsequent pregnancies, it's always advisable to take your previous pregnancy records to your doctor, because looking at the records will give us an idea as to what has to be changed in the subsequent pregnancies. There are certain modifiable risk factors that can be corrected before you attempt the next pregnancy. And also, if ever you have history of recurrent abortion, certain investigations need to be done to see if any particular injections or tablets need to be started in the pregnancy that you're planning. Now coming to management of pre-existing conditions. There are some people who might be on certain drugs. So like for example, you're a diabetic, you're on oral hypoglycemic drugs, or you have BP and you're on certain drugs, or you have fits, for example, you've had history of seizures. So you might be on some drugs. See, it's important to show the doctor what drug that you're on, because there are some drugs that can cause anomalies in the baby. The initial 3 to 10 weeks is when your baby's organs all get developed. So any exposure of the fetus to any abnormal, any drug that can prove to be harmful, or if you have any other condition that can harm the baby, it can actually impair the growth of the